In completing the leadership skills questionnaire, I realized that I fall in the high range of administration, interpersonal, and conceptual skills. Although I have never really had much interest in nursing leadership due to personal reasons, it is evident that I have skills necessary to lead others and complete tasks. Statements regarding work detail and understanding of leadership concepts I agreed were very true. And in using my facility's patient-centered care model based on compassionate, respectful practice, quality outcomes, expert clinical practice, clinical knowledge and personal growth, interdisciplinary and collaborative practices, and participative management, I believe I could be an effective nursing leader, able to manage the staff and ensure that the patients are safe and cared for and that the unit runs accordingly. Of the skills identified by Grohar, Murray, and Langland, I would readily use organizing and coordinating first to understand the needs of my facility or unit and develop solutions to any issues that may arise that are necessary by involving my staff in a team approach. These are two strengths that I feel I possess as a staff nurse now and use them daily in my assessments and interactions with my patients and my coworkers. In the article Resistant to Change in the Nursing Profession, Creative Transdisciplinary Solutions, authored by Carrie S. Clark, she discusses shifting the paradigm of nursing to caring, love, and healing. She believes that a transdisciplinary approach allows for the organization of knowledge to grasp and address the complexity of situations and take account for the values, ethics, and experiences in the nursing profession. The idea is focused on research and causes us to question our own assumptions. She also writes that we need to understand that knowledge is created from a simplistic thought process, and this needs to become more complex and connected. Accessing information leads to more inquiry and building of knowledge. And in my role as a nurse leader, I would need to work with various levels of and departments throughout the facility, starting on my own nursing unit with the nurses, CNAs, doctors, social workers, and then collaboration with other patient care units and their respective directors and managers, on to other departments such as laboratory, radiology, cardiopulmonary, food and nutrition, environmental services, maintenance, communication, and info technology, and nursing informatics. And lastly, the across-the-board nursing directors of each unit, clinical administration, and administrative directors on up to the chief nursing officer. My preference of either vertical or horizontal organizational structure would depend on each particular task at hand. What are we really trying to understand or change or implement at that time? I can see when each one could be favorable depending on what we're trying to do. In the case of vertical, I think that should be used when there's a need for more clear, concise, critical decisions being made, and horizontal would be more for day-to-day operations, less critical tasks. I feel that there could be a combination of both depending on the level of the different levels of interdisciplinary care, and it could be beneficial to have the combination. I'm looking forward to see what you guys have to say and continue this discussion. See you soon.